a big topic because healthcare, there's so many companies and there's a variety of different categories, a lot of different tools to solve problems. How do you know what is the right tool to manage a health issue, whether it's specific like diabetes, broad for any type of chronic condition? And by tool, I mean, is it a mobile application? Are we talking devices? Is it telemedicine services? Does it come directly from a provider management application? How do you know what is the right tool and for health management or managing any form of health? And I assume it's a pretty broad question because there's a lot of different health verticals, so it's hard to
It
answer.
is.
But
It
yeah,
is, and the answer is evolving. So part of it is experience. Part of it is having watched patients over the course of 20 years of medicine. You get a feeling for what people are going to respond to and what they aren't going to respond to, and so. And part of it is psychology. If you're dealing with changing patient behavior, a lot of it is psychology, but you really get exposed to that aspect. I like to think about these things in I'll go off topic for a moment, but I'll come back to it. I like to think about this in terms of my views on smoking cessation when I was a practicing physician. Um, I saw hundreds of patients a week, and a fair number of them were still using tobacco. And you would offer them the opportunity to help them stop. You could tell within 5 or 10 seconds which people were interested and which weren't. And there's really good evidence to say that your time is best spent on that small subset that are open to the idea or contemplative about making that change. And once you identify that someone is in that contemplative state instead of pre-contemplative, well, then go with all your effort at contemplative. Your efforts are best focused on those people thinking about quitting, as opposed to those who aren't even willing to consider it. So that's where all of these tools come in. What's going to predict where a clinician's best efforts are spent making change in healthcare? And so I think that's what you're seeing in many of these companies that are looking at chronic disease and how to manage that. That's Tula. When you take all of this information in from patients and you look for pattern recognition, you'll be able to detect those people who are contemplative about making a change and focus on them, and then continue to search for more people who are pre-contemplative and try little interventions to get them to move to that contemplative state. A little bit off exactly what you asked, but one of the things that we look at in terms of changing human behavior and saving the healthcare system lots of money.
no, it's an interesting example that you give, especially going back in time and talking about smoking issues. And I think this is one of the difficult parts of another caveat of the difficulties of healthcare is how much psychology goes behind actually trying to get people to want to do something with their health. And like you said, changing behavior is not easy. It's not like you could throw a simple tool up, fee for service kind of. It's really difficult to get people to move on some health issues they've been dealing for a while.
Well, it's not that anybody doesn't want to do something with their own health. It's that people have priorities. People want to be healthy, but people want to enjoy certain aspects of life as well. And those don't always, there's a Venn diagram there without complete overlap. And so it's just a matter of helping people to see the choices that are best for them.